People ask me over and over, how are your students across the country so competent and ready for the workforce right out of class? It's simple. I built this program by combining the classroom and clinical experience into one. There is nothing in the clinical setting that a student sees that I don't replicate and show them in the classroom. When I started the school 23 years ago, I quickly learned that the clinical experience was not all it was cracked up to be. Students consistently complain about having to spend their extra money to get their immunizations current, taking a week off from work, paying for their own negative drug test and background check, the insurance they have to pay for and carry for a year, so on and so forth. They also don't like the required OSHA training and orientation before participation. The amount of time, effort, and energy just to participate in the externship is oftentimes longer than the class itself, and more expensive. And on top of that, the amount of blood draws a student gets is a variable that is completely out of everyone's control. Some facilities have a good amount of patients during the week of the student's attendance. Others only a handful. And students end up taking out the trash, filing charts, and sweeping floors instead of drawing blood. And this is far too frequently the case. Also, the clinical staff who the students are assigned to on an externship is a complete guessing game. Sometimes they are assigned to someone competent, patient, and knowledgeable. But more often, they're assigned to someone who is not trained themselves, and the amount of incorrect information given to the students during their externship is alarming. This only creates more contention because our students are constantly correcting the clinical staff. By combining all the things students need to learn from the book and all the hands-on clinical experience they need to know, we can produce an incredibly competent student who is ready for the workforce right when they finish class. Employers love our students for this reason. Everything a student sees in the clinical setting of a normal laboratory job, we teach them to be proficient at in class. And this has proven for almost 23 years to be a very effective way of training students. They get the knowledge and skills they need without having to spend any extra time or money to do so. We feel this is the most effective and economical way to train students.